Good evening, my name is Ruben Gonzalez and today I will be doing a post-fall horror video. The reason that I'm doing this video is because I would like to do a risk assessment and prevent the patient from falling in the future. Moreover, explore different routes to educate the staff, the caregiver, and myself to keep the patient safe. The healthcare staff will be collaborating in assisting June to prevent him to fall again, and educate his daughter to learn other ways to maintain a safe environment for her father. The members of the healthcare team that will be present in the post-fall huddle are the CN, the UAP, attending physician, nurse manager, occupational therapy supervisor, social worker if possible, and finally the primary RN, which is myself. I would like to emphasize that geriatric population falls are frequently due to environmental hazards, diminished senses, cardiovascular responses, or responses to medications. In this case, June, our patient, had all of the above. June is 65-year-old male, oxygen dependent, ambulated with walker, secondary to unsteady feet, and diagnosed with pulmonary hypertension and dementia. In addition, his daughter is the caregiver that helps June as much as possible, but sometimes is out of her hands to be there 24/7. Sometimes it's frustrating, it creates anxiety for both the patient and the caregiver. June, our patient, fell to the floor in the hospital because he needed to use the bathroom. His daughter helped him to ambulate, but the room was cluttered with furniture, and June fell and fractured his hip, unfortunately. Today I'm going to talk about tools that will help the healthcare providers to assess the risk of falling, such as the Morse fall scale. The Morse fall scale is another tool frequently used. Institutions can use the score on the Morse fall scale by answering 6 questions to identify patients at risk for falls. So I'm going to talk about it. So the first one is history of falling, or immediate or within 3 months. We know that the patient fall in the hospital, so he's going to score 25 points right away. Then the second one is secondary diagnosis. The patient has a history of dementia and pulmonary hypertension. He's gonna score 15 points right away. The third question is ambulatory aid. The patient, even though forgets to use the walker, he uses a walker, so he's gonna get 15 points. The fourth question is IV/heparin lock, and the patient scores 20 because he's currently receiving levofloxacin via IV, so that means he has established IV. The fifth question is gait or transferring. In my opinion, I put 20 because as I was reading, it says the patient has difficulty standing up and has unsteady on his feet. So that's my opinion. The sixth question is mental status. I score 15 for this one. The patient has dementia and he forgets to use his walker, so I don't think he transferred himself that well because it looks like he depends in his caregiver, which is his daughter. So we got a total score of 110, and the risk level is high risk. It's greater than 51, and also the action is that we're gonna implement high risk fall prevention interventions for this patient. Okay, now let's talk about the areas of improvement that I need to implement to prevent June from falling again. Number 1 will be elimination of potential hazards such as furniture, wet areas on the floor, and clutter. Encourage the patient to wear appropriate non-skid footwear. Encourage the patient to allow his legs to dangle off of the stretcher before standing is really important. Keep the bed in a low position. Leave a night light on. The patient also need to be monitored for any signs of dizziness, GI upsets, and increased risk of tendonitis because he is currently receiving levofloxacin. Therefore, educating the patient and the caregiver is a priority about the new medication that he's receiving. Also document and report any changes in the patient's cognitive status to the healthcare team and the change of the shift, and properly transfer is really important. Ask the patient if they need to use the bathroom before leaving the room is also extremely important. Consider a sitter because the patient keeps forgetting stuff due to his dementia. The ultimate goal is to keep the patient safe from any further falls, in addition to emphasize the healthcare team to take part in the training that the hospital offers about the fall prevention, read educational brochures, and use algorithms that contains questions that will help to prevent and be aware of any falling. Such questions will be: how you fall in the past year? Do you feel unsteady when standing or walking? Do you worry about falling? That way we'll be able to triage the patient in a better way. Thank you very much.